morning, myself Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the causes and the treatment of the spondylosis. So first are the causes. First is aging, that is the spondylosis are most common in the old age persons. Second is repeated strain injury, which are caused due to lifestyle without ergonomic care. For example, by working in front of computers, driving, traveling, or intense work in the farm. Risk factors includes genetics, smoking, occupation, mental health issue, and injury or trauma. Next are the symptoms of spondylosis. Symptoms includes are joint pain, tenderness, swelling, muscle spasm, and limited range of motion. Next are the surgical management of the spondylosis. First includes laminectomy, that it is the removal of the bony arches of the spinal canal that result in the decreasing pressure on the spinal cord. Second is discectomy. Discectomy, it is a procedure to remove a portion of the intervertebral disc, that is IVD, that putting pressure on the nerve root or the spinal canal. Next is foraminectomy. It is a procedure to expand the opening for the nerve root to exit the spinal canal. Next is fusion. Fusion of the vertebrae is sometimes combined with one or more of this procedure in order to stabilize the spine. Next is the pharmacological management, in which first is acetaminophen. So most common acetaminophen use is Tylenol. It is a type of the medication that are proved to be a good pain reliever, and acetaminophen works by essentially blocking the brain perception of the pain, and it is good for pain flare-ups that may come with spondylosis. Next is muscle relaxant. Most of the anatomical changes of the spine form spondylosis. Muscles may have to work harder to support the spine. Sometimes the muscle can have spasm as they become overworked. So muscle relaxant help to stop the spasm, and the most common muscle relaxant use is Valium. Next is the physiotherapy management, in which first is heat therapy. Heat therapy are used to improve blood circulation, decrease nerve and muscle inflammation, and relieve muscle spasm. And the cold therapy is used to reduce inflammation, relieve muscle spasm, and to reduce nerve irritation by reducing nerve edema. Next are the soft collars or neck immobilization. Immobilization limits the motion of the neck, thereby reducing the nerve irritation. It allows the muscle of the neck to rest. Soft collar should only be worn for short periods of time because long term can decrease the strength of the neck muscles. Other physiotherapy include is electrical stimulation, in which commonly used are TENS and SWD. TENS can be issued for a patient for home use, and TENS are mainly used for the radiating pain. Next is SW, that is short wave diathermy. It relieves the muscle spasm and causes muscle relaxation, reduce inflammation, and improves blood circulation. Next is traction. This form of treatment may be useful for spondylosis because it promotes immobilization of the cervical region and widens the foraminal opening. Next physiotherapy management is manual therapy, such as mobilization and manipulation. Mobilization is characterized by the application of gentle pressure within or the limit of normal motion, and the main goal of mobilization is to increase the range of motion. And manipulation is characterized by high velocity thrust, which is often delivered at or near the limit of the range of motion. The intention of the increase article mobility or to realign the spine. Thank you.